you. Thank you, Peter, and thank you all for coming or for joining online. So my talk is called Fortress Australia and E-Narnia. Did unique adaptations help Australia and Estonia during the pandemic? Now, as Peter mentioned, I'm a science journalist from the ABC, the Australian Broadcasting Corporation, but I'm also a rare Australian who's been allowed overseas recently. So you have probably not heard a lot of the kind of Australian twang accent recently as the world has begun reopening. And that's because Australia pursued a COVID-0 approach to the pandemic. We had some extremely strict policies to try to stamp out every infection in the country. And so I'm the journalist in residence here at HITS right now, but I was meant to be here last year, and I was only recently granted access to the rest of the world, thanks to my government allowing me to travel beyond Australia's borders. And one other thing I'll mention here is that I think it's quite rare for people to live, like substantively live in different countries throughout the pandemic because we've been kind of locked up at home and often borders have been shut. And so I've been incredibly curious to see how Germany is compared to Australia and how many European countries have dealt with the pandemic. And before the pandemic began, I actually had my eye on the small Baltic country of Estonia as well, which is often described as one of the most advanced digital societies. And as soon as the pandemic hit, I was quite curious to see how this digitalization of their society was going to impact how they went through the pandemic. Now, the last couple of years obviously have sucked, but there are a couple of glimmers in all that darkness. The first one is obviously the race to get the vaccines out and how quickly that's happened. That's wonderful. The other one that I want to focus on today is we've kind of had hundreds of bizarre social experiments all around the world. And I think these social experiments can actually help guide us when it comes to future pandemics, but also guide us into the future, into our new hybrid lives. This blended life of digital and physical that we began moving into has definitely been accelerated throughout the pandemic. And with many of you here in person or watching online and us having this hybrid event, I think this is a very good illustration of that. I also think that once we kind of got through the worst of the pandemic, vaccines were being rolled out around the world. I think there's a lot of fatigue, and media organizations have noticed this and have stopped publishing a lot of kind of coronavirus-related content. But I think that we actually need to spend our time comparing our experiences and sharing our stories about how other nations have dealt with these massive changes in their societies, and hopefully to learn some lessons from other countries, the missteps, but also the successes. Now, before we dive into the two case studies today, looking at Australia and Estonia, I should point out a couple of caveats. The first one is that summarizing the pandemic experience of any country in like a full 360-degree way is very hard and almost impossible to do in roughly 50 minutes. And I'm going to whip through two. So I'm just focusing here on the broader trends in these two countries, and I'm aiming for people who are outside of Australia and Estonia as well. All right, now we're going to begin in Bondi. So these are some pictures of my old hometown of Sydney. Only the top right is actually of Bondi Beach at dusk. The other two are from Maroubra and Coogee, both looking up the coastline towards Bondi Beach. And I figured that a stereotypical Australian talk should begin with a bit of propaganda from our beaches, but you're very fortunate that I didn't also include a picture of a surfer. Sorry. Now, the reason we're beginning at Bondi Beach is because I wanted to introduce you to a limousine driver, a man in his 60s who was ferrying international airline crews to and from quarantine hotels, from the airport in Sydney through to these quarantine hotels. Now, this man is one of the few people who would have significantly noticed the effects of the pandemic in Sydney and in Australia at the time, because in the middle of June 2021, while the world was battling the Delta strain of the virus, Australia was relatively normal, if you can use that term. The COVID-0 approach of Australia had been largely successful in terms of stamping out cases and allowing Australians to live a pretty standard life, a pre-pandemic style existence. And so other than seeing people in masks, and other than workers like this limousine driver who were dealing directly with people in the front line of coming in and out of the country, there was not a lot of noticeable difference in Australian society. And because Australia had been quite successful at this point in the pandemic, it was sometimes referred to as Fortress Australia. And you can just see those numbers on the side there. I've just added as a bit of a reference point for you. At this point in the pandemic, middle of June 2021, Germany had 3.72 million cases cumulatively, while Australia had 30,000. And even if you take into consideration the different sizes of the population, Germany's 83 million, Australia's 26 million, you can see that Australia's doing pretty well there. And here's a graph to show that as well. So this is a comparison, a 7-day rolling average of cases up until this point, June 16 of 2021. And you can see in green there, Germany, and in blue, Australia. This is just the raw number of cases. But even if you take into consideration population size, you can see that Australia is doing pretty well, especially when you look at the kind of the latter half of that graphic from late 2020 through until 2021. It's pretty much a flat line in terms of cases per million people in Australia, while the rest of the world had gone through fairly similar spikes, especially with the Delta wave at that point. This was all about to change when this man in his 60s, the limousine driver, tests positive to the Delta strain of the virus. And within 10 days, Fortress Australia was going to be breached. Now, a couple of things that I want to mention about this limousine driver. The first is that at the time, police began investigating whether he was abiding by the very strict measures that we had in place, things like wearing appropriate PPE and masks and so on, and whether he was doing regular testing. And I should also mention that he was not the first person to break through. At the time, a lot of people described these sort of breakthrough cases that made it through these levels of security in Australia as embers that could start a fire. And there'd been several embers that had broken through containment lines, but they'd been stamped out. And I think the difference in this case was that A, it was Delta, the Delta strain that this limousine driver caught, and B, they were testing positive for quite some time before they actually officially tested positive. They were likely infectious in the community for a while. And he also visited some very busy shopping centres in Bondi and some cafes as well. Now, before we look at the effects of this one positive case in June 16, 2021, I wanted to go through a little bit more closely what COVID-0 looked like in Australia. You probably got a sense of what COVID-0 is from hearing about it, reading about it, but I wanted to kind of talk just specifically to what it was like in Australia. So the first and most important thing is that our international borders were largely closed. So other than freight coming through, and very occasionally some people traveling across borders, mainly for diplomatic missions, there weren't really people leaving Australia, coming into Australia, unless they were repatriated Australians. Anyone coming back into Australia also had to go into extremely strict quarantine. And these quarantine arrangements that we had set up, we had hotels specifically designed for this, were pretty good. There were some issues at some points in the pandemic with cases traveling within these hotels, but they were designed specifically to deal with people coming in from afar and had very strict quarantine measures in place. And we also had really exemplary contact tracing. So if any of these embers did break through containment lines, then we had huge numbers of staff in Australia to trace people who may have come in contact with them and to put them into isolation or into quarantine. We also had extended lockdowns. So I think everyone at this point knows what a lockdown is and has experienced plenty of these as well. But you might remember that some parts of Australia, for example, Melbourne, it was one of the most locked down parts of the world. I think it was more than 250 days of the pandemic up until this point, it had been in lockdown. And this is because if ever there was even just a tiny breakout of cases, then the first thing that governments did at a local level was immediately go into these snap lockdowns and sometimes extend them for even longer as well. And then, of course, there was also regular testing for any at-risk workers. These are frontline healthcare workers or people like the limousine driver. I think the other important thing to mention here is that it wasn't just Australia had a great plan to do COVID-0. Like we were lucky enough to have an island nation that was far away from most other countries. And we also had quite a strict border control in place already in Australia. For anyone who's travelled to the country, you would have gone through some pretty strict immigration and border security. And I think this sort of helped. We had like layers of defence already built into the border system. And I think as well, there's this term that we use in Australia, which is the tyranny of distance. And this is to describe kind of being further away from global conversations, from a lot of the action around the world, and how living in Australia, in modern Australia, is quite difficult because you feel disconnected from some of these things. But I think that can be a double-edged sword. I think if you're in the middle of a catastrophic pandemic, isolation ain't such a bad thing. And so a few more graphs just to see the effects of COVID-0 and how well it had worked up until this point. So this one is showing Australia through the pandemic, through until June 16 of 2021. And these are cases per million people and deaths per million people. And you can see that we in Australia, we did have some initial surges. We had some people coming through from China and also from other countries. And we also had a fairly significant outbreak, so that second outbreak around August, September, that led to quite a lot of deaths in Australia because that made it into aged care homes at the time. But when you look at these outbreaks compared to a country like Germany, and again, these are cases per million, so this is controlling for population size. Germany's there in the red, whereas Australia is there in the black. And you can see that these case numbers and also these death counts across the pandemic through until this point were just nothing compared to what most other countries were dealing with. And Germany, in the European setting, was doing reasonably well too. So I think this really shows, especially the back end of that graph again, it really shows how well COVID-0 was working in Australia up until this point. Of course, there's other impacts of COVID-0, so it's not just cases and deaths. And I think the first one is that, of course, there were adverse economic impacts like in every other part of the world that tried to deal with the coronavirus in their own ways. But I think even with all these lockdowns, we did manage to mitigate a lot of this with significant government stimulus for the hospitality sector, for example. There were some areas that struggled quite a lot. For example, the arts in Australia really struggled. But I think overall, when you look at how Australia came out of the pandemic, unemployment's quite low. We did go into a recession, the first in about 30 years in Australia, but it was the mildest of recessions. And I think we're sort of on the way up and out now. And so economically speaking, I think Australia has managed it reasonably well at the expense of a lot of government debt. Of course, there was also mental health stress and fatigue like in every other country. And in Australia, this did lead to small but violent anti-lockdown and anti-government protests, but not to the same extent that you've seen here in Germany, for example. And I think most importantly, the main sort of impact of COVID-0 in Australia is that it bought time for Australia's health system. So having that huge, big stretch through the late 2020 and into 2021 where there were very few cases at all, and where COVID-0 was working quite well. This meant that Australia's medical system could buy in extra ventilators, set up new isolation wings, set up more doctors and protocols so that they were ready to treat like a surge of patients. They were also able to look overseas and see what was working best in terms of treatment regimes, drug treatments, and so on. And so I think Australia's health system was bought all this time by COVID-0 and was able to use that time quite well to build up its defences. The hospitals were well fortified. There's one downside to this, which is that unfortunately, this may have meant less urgency when it comes to securing vaccines. So you might remember around this time, sort of middle of 2021, there was a lot of discussion around these newly emerging vaccines, whether they were truly safe. And I think there's still a lot of skepticism in some segments of the community right around the world. But in Australia, I think COVID-0 allowed Australia to kind of step back and think, oh, we're safe. And so maybe we'll just watch the rest of the world and see how these vaccine rollouts go in other parts of the world. And maybe we can just pick our favorite after we've seen some of these early results coming in. There was also a lot of discussion within the Australian community about which vaccines they were most happy with. So I don't think this is something you can land purely on the government's shoulders and say they were slow. I think they were kind of reacting in a way that was in line with what the populace was thinking, which is, we might want to sit back, watch these results come in and figure out which vaccine is going to be best. But I think this is something that we're going to see the effects of soon, not being urgent about securing vaccines and rolling them out in the country was perhaps a misstep in Australia. All right, so June 16, 2021, our limousine driver tests positive. And this outbreak was about to undo a lot of Australia's excellent work up until this point. So within a couple of months, from June 16 until August 21, you can see there, we're already on the exponential growth curve in terms of new cases, 7-day rolling average in Australia. And I think something to mention about this curve is that, first and foremost, it's a more virulent strain. So this is the Delta strain that broke through. It found a population that had basically no immunity at all. So at this point in Australia, the vaccine rollout was incredibly low, and it only made it to some very at-risk people. And I also think that whereas in other parts of the world, other strains had infected certain chunks of the population, and then you had immunity built up from those earlier infections, we had none of that in Australia because we really didn't have significant waves beforehand. I also think that some of the protections that we were using at this point in the pandemic were pretty weak. So when I arrived in Germany at the end of 2021, I brought a cotton mask with me, thinking that's fine because that's all we were using in Australia at the time. And I was a bit shocked to learn that in Germany, it had been months since people had used any of those cotton masks. Everyone had switched to the FFP masks. And so I think like this COVID zero approach, we put all that effort and time into making sure that was working really well, but maybe we weren't keeping up to date with what was actually happening in other countries and best practice protocols to try and stop the virus and to contain it. And so you can see here, I think probably the most telling thing here is that our vaccination rate was low. And I just wanted to show that. So you can see here on August 21, as that curve is rising very rapidly in terms of cases, compared to Germany, where the vaccination, this is total doses of vaccines, by the way. And you can see in Germany, the vaccine rollout it's starting to kind of plateau now. The rollout's sort of finishing. Whereas in Australia, we're only just getting going. And you can see if you look to sort of June, the vaccination rate was really, really low in Australia. And I think this was us kind of sitting back and waiting for the best decision around like, oh, which vaccine should we roll out, which should we buy? Australia had not secured a lot of vaccine doses at this point in the pandemic. And so they started acting as quickly as they could, but in the midst of this massive outbreak. And so they began calling in favors, trying to ask other countries whether they could buy 1 million doses now and we'll give you 1 million later, talking to all the companies and saying, just send us whatever you've got. And so you can see that the vaccination rate is creeping up. And of course, single dose a little bit higher than that at this point. So it was about 40%, the single doses. But in terms of double dose and the best immunity you can get from vaccines, Australia was way behind just as this Delta strain was sweeping through and when we didn't have all these other best practice protocols in place. Then things got worse. So this is going through until the middle of October now. And it broke through containment lines in Sydney, like within the country. It broke out of Sydney, it broke through locked state borders and made its way into other states in the country. And so it just kept spreading. And by December, things are starting to look a little bit better. It looked like the worst of this Delta outbreak was over. We'd managed to race through the vaccination protocols. We'd managed to get over 70%. And so lockdowns began easing. Now, there's one sort of bright patch in what happened here, even though many claim that this outbreak was mishandled, the vaccine rollout was mishandled, and that is that the death rate did remain quite low throughout this outbreak. So you remember that the cases are much higher in this outbreak towards the end of 2021 than in earlier outbreaks, and yet the death rate remained quite low. And that's because even though we were racing through this vaccine protocol, we were able to get vaccines to the most at-risk people first and to frontline health workers first. And so there's some evidence that there were a lot of cases from people who were working in medical settings or working out in the field in jobs where they couldn't do it from home. But a lot of the most at-risk people were getting those vaccines, those early vaccines. Unfortunately, things got a little worse. So you can see here, we're at December 4th of 2021. Everyone's starting to feel a little bit comfier. Vaccinations around 70%. And I just want you to pay attention to the scale along the y-axis here. So we've got 0 to 2,000 there, and then 0 to 100,000 by January 13 of 2022. I'll just go back and forth a bit there. So this is December 4th, 2021. And then by the time we get into middle of January 2022, it's about a month later, we just had this enormous burst in cases in Australia. Now, there's a lot behind this curve. The first thing is that this is Omicron. The second thing is that after we hit that sort of 70% vaccination rate in Australia and began opening up borders again, I think the government and the Australian populace was getting a little bit weary at this point with lockdowns, with the pandemic in general. They wanted to see their families for Christmas. And so a lot of the restrictions that were in place were just kind of thrown to the wind and the floodgates were opened. And so around Christmas time, people went home. A lot of the restrictions that were in place were removed. And just to show how significant this burst in cases is, I also wanted to show you it compared to Germany. This is just raw numbers here, so not controlled for by population. Australia was double Germany's case numbers in the middle of January at this point. And this is, again, not controlling for population size. Australia, a much smaller country, was double that of Germany in terms of case numbers.
And it's summertime in Australia.
Yeah, and it's summertime, yeah. So this surge was enormous. So what was going on there? Well, like I said, I think people were just kind of weary. The vaccination rates were high enough. It was Christmas time. People sort of opened the floodgates. But I think Omicron found a population with very limited virus immunity. They had vaccination immunity, but not immunity to prior infection, and with extremely lax containment measures at this point in the pandemic. So just to give you an example of what I mean by that, I think testing is probably the most salient point here. When I arrived in Germany at the end of 2021, every corner through Heidelberg had a Schnell test station, a quick testing station. At the same time in Australia, you couldn't buy a rapid test anywhere, and there was no Schnell testing funded by the government on any street corners. We were relying almost entirely on PCR testing at this point. And often the backlog in cases was so long that you would get sick, have a PCR test, and then find your result 3 weeks later, which is useless when it comes to coronavirus. And so without having testing regimes in place, we were really hamstrung in terms of how we could react to this pandemic. So you combine that with just throwing open the floodgates, opening borders, letting people in, letting people travel within the country. You then kind of look to, all right, what other defenses do we have? Contact tracing maybe, but they just could not keep up with this enormous surge in numbers. And so unfortunately, in this Omicron surge at the end of 2021 and into early 2022, we did see the death count rise in Australia. So again, this is that same graph from earlier, which is showing the new cases per million, the rolling average, and the new deaths per million. This is just up until June 16 here, but then we go a little bit further along into December 4th. So this is showing the Delta outbreak. And you can see there the deaths per million, a little bit lower than some of those earlier outbreaks, despite the higher cases in this Delta outbreak at the end of the year. But now we go ahead to the Omicron outbreak around Christmas into the beginning of this year. And you can see that there's this huge spike in cases followed by an even bigger spike in deaths afterwards. And so in 2022, Australia accumulated more COVID-related deaths than in the previous 2 years of the pandemic, which is a real shame. Now, I was curious, because a lot of people have claimed that Australia mishandled this reopening, and I think there's a lot of evidence that we've gone through there that shows that that might be the case. But I was curious to compare it to another country that is often celebrated for its COVID zero strategy. And so just very briefly, I wanted to give New Zealand a special mention here. And I just compared that same graph that we saw a moment ago, this one here, to New Zealand. And when you compare the two, what you see, this is New Zealand in red here, is that when New Zealand does open up, they have a very similar case curve and death curve per million. Now this is controlling for population in both countries. And so you can see that New Zealand's COVID zero strategy had done wonders for them up until this point of opening about a month ago in the pandemic. Even in the very early stages of the pandemic, New Zealand had done really well. Death count remained really low. But then when they did open up with high vaccination rates and with better protocols in place to manage the growing case numbers, I mean, New Zealand's death rate rose, its case numbers rose to a similar extent that we saw in Australia. And so I think this is kind of the crux of it, right? Like, what can we take away from this? What can other countries, looking at Australia, the examples that we've seen just now, what can they take away from this? And I think the main thing that I think other nations would be interested in is that COVID-0 approaches are unlikely to work indefinitely. And we're seeing examples of this in other parts of the world now too, whether it's China or North Korea. A lot of that data is perhaps a little bit hazy, but we're seeing a similar trajectory in cases and perhaps even deaths in these countries that are reopening now too. But I think what COVID-0 approaches can do for us is they can buy us time. And we can use that time really effectively. So I think the example in Australia is that we're able to use that time to beef up our healthcare systems and prepare for the surge to come. But I think what we didn't do terribly well in Australia is that with a virus that is as infectious as this one and as deadly as this one, you have to use that time that you buy yourself with something like COVID-0 to prepare adequately for the worst. I think we were sort of in this holding pattern, imagining that we might be able to keep it out for longer and stall a little bit later and pick the best vaccine a bit later. But I think what you can take away from looking at this is that you have to prepare for the worst and be ready for it to hit at any point. All right, so that's how things played out in Australia. And now I wanted to look at another country with a different set of unique pandemic preconditions. And that is the small Baltic nation of Estonia, highlighted in red there. Now, a couple of things that I wanted to mention about Estonia is that it's often branded or like self-branded as e-Estonia. And this is because there's been a movement inside Estonia. It's quite small population, it's like 1.3 million people, right on the edge of Russia and the Baltic Sea. But there's been a movement since their independence from the Soviet Union to try to digitize all of their interactions with the state. Because they're quite small, they can, there's ways that you can do this. You can set up new systems quite effectively and efficiently. And so they've been quite successful with this project over the last 2 decades of basically making all government services online, not having to interact face-to-face with people. And this system is underpinned by basically every single citizen has a unique digital identifier for all of their state services. And this is attached to an electronic ID and also a digital signature, which you can use. And so this is what it kind of looks like if you log into your system in Estonia. You just see a little hint of what it's like there. One of the Estonians that I talked to when I visited Estonia in March or April of this year, she was showing me this service. And basically, you log on and you have access to every single set of government data you can imagine. So whether it's your university debts, your cat's vaccination history, your medical records, your voting, you can do that through this portal as well. Everything is stored here. Your relationships, your housing, it's all stored here. And you're also able to use this portal to quickly go through all those processes that you normally have to go to a local government branch for and fill out lots of hard copy forms for. So for example, she showed me you can set up a business online in just a few clicks, and it's pretty quick. And so when I heard about this system before the pandemic and then the pandemic struck, I thought, oh God, like if you can limit your interactions, your face-to-face interactions through the pandemic, whether that's with bureaucracy or with other people, then surely that's going to help you to help contain the virus. A little bit more about Estonia's, or e-Estonia's e-government. So one of the things that people often say about this is that it saves them a lot of money on bureaucracy. So the former Prime Minister says it saves about 2% of GDP. And it's not just state services that this helps with, it's also speeding up interactions with government. So if you want to apply for a bank loan, or if you want to apply for a new telecommunications plan, internet, phone provider, whatever, you can use your digital signature, your data, as it's stored through these government services. You can quickly add that to companies' portals as well. And they also have reasonably strict privacy and security settings. I talked to some of the original engineers of this e-government project in Estonia, and I think there's always going to be concerns around these issues, and I'd be happy to field some questions later on when we get to questions about exactly what they do here and how they approach it. But I think I was broadly convinced that so far the system's been working pretty well in terms of privacy and security, and I think they're doing a pretty decent job. One last thing I'll say about Estonia or e-Estonia is that I heard this term e-Narnia while I was talking to a bunch of people there earlier this year. And I think it's a really interesting term because it's actually used in a negative way. They use it to kind of dismiss this idea that you can develop a magical fairy tale digital society. You can just step through a portal and then it exists. They acknowledge that it's been 2 decades of really hard work for them to develop these new digital services, and that sometimes they have made a wrong step along the way. And I like this term because based on my experience of going there and talking to a couple dozen people across different sectors of Estonian society earlier this year, I don't think there's a fairy tale digital solution to a pandemic either. So I like this term e-Narnia. Now, you get to experience a little glimpse of the project that I've been working on up in Estonia about how the country has adapted to the pandemic and how these digital services have helped. I'm going to introduce you to a few of the people I talked to, and we're going to play some audio snippets. The first person I wanted to introduce you to is Carmen. So she works at the e-Estonia Briefing Centre. She's a millennial like me, and she loves the digital services in Estonia. And one of the things that she loved most was how quickly she could do her tax, which I think many here in Germany would be very envious of. So I'm going to play a little snippet of her in a second. And I think she gives you a sense of how some of these services might have helped through the pandemic as well.
So you don't have to worry about doing taxes. You don't have to be worried about waiting in lines or finding the right offices. You can do everything online. So in comparison, I know in the States, for example, it's such a headache to do your taxes every year. You oftentimes need to hire accountants and so on to manage everything. But here in Estonia, we do our taxes under 3 minutes. Easy as that, and that's with most of the things.
Just from that one example of taxes, filling it out online, it's efficient, it's already set up and in place before the pandemic. This transition to living, working, studying, everything from home would have been pretty easy for Estonians. So the next person I want to introduce you to is Anu. So she works for the e-Governance Academy in Estonia. She's got 3 kids, all boys, and she told me about 2 things that I think are quite interesting. The first is homeschooling during the pandemic, and the second is buying and selling property. So on schooling, she said that in Estonia, it was like in any other part of the world, an absolute nightmare for the first month. And I said, what do you mean the first month? Why not the first 6 months? Because I think in a lot of other parts of the world, like schooling was a nightmare through until now, or way deep into the pandemic. And I don't think a lot of systems adapted terribly well. Whereas in Estonia, they had sort of a month of like teething issues where they were trying to figure out how to do Zoom and whether you could do a PE class via Zoom and so on. But they were quite quick to adapt. And one of the reasons they were able to adapt quite quickly is because they have this infrastructure called, I think it's called e-learning or e-schooling or whatever in Estonian. And it basically allows communication between teachers, students, and parents. It allows them to send homework, report cards, let them know when exams are coming up, for example. And so you had this communication backbone, which really helped, I think, with some of the more efficient, like making it efficient. And then I think because Estonians already spent a bit of time online, they were able to adapt reasonably quickly to Zoom. But the other example that I found really interesting from Anu was in the pandemic, she bought and sold a house entirely online. This is one of the newer features of Estonia's like e-governance system, is that there were very few things on the list of you can't do this online. And one of the most recent additions was buying and selling property. And so this is what she had to say about that process, buying and selling a home entirely online during the pandemic in Estonia.
It was a very interesting experience, actually. Last winter, we decided to buy a house in South Estonia. So with 1 hour, the house changed the owners. The only thing we needed to do is to use our ID cards, make this face recognition remotely, and then we entered the environment where we could see other participants. So there was a representative from a bank, the owner of the house, and then the notary. But what you can't do online is getting married and divorce. I haven't tried. I have to believe that it is not available online.
So as you heard there, pretty quick and easy. And it just meant that, she and the bank and the notary, they didn't have to travel for hours across the country, meet people in person. And in a pandemic, if you can do this kind of stuff online, it just seemed pretty obvious to me that that would have helped with reducing caseloads and so on. All right, so another example. I've got two examples up on the screen here. So the first one is over on the right. I mentioned Anu's three boys. They were able to use this e-learning software, which basically allowed them to communicate with the teachers and parents all in this one platform. So I visited a school in Tallinn, the capital of Estonia, and I talked to a few students there. And they showed me what that app looked like and how they're using it now. And they also showed me how they were able to join their classes online or in person. And it seemed like they have a fairly rigorous and robust hybrid system in place now. And they didn't seem too perturbed, like dipping in and out of digital learning. And they felt like they were pretty savvy. They could easily jump online early on in the pandemic and learn there. But the other example, and this is the one I'm perhaps most sort of interested in, is the court system in Estonia. So the court system had already established some really interesting digital services pre-pandemic, and then through the pandemic they kind of built on that. And so I'm going to introduce you to Liina on.
My name is Liina Naaber-Kiviso, and I'm the president of Viru County Court. Before COVID, when I started, I live in Tallinn, in the capital, and I go to work 250 kilometers once per week, twice per week, to have the hearings there. But other than that, I work at home. So our court was already well familiar with the digital solutions before COVID. And for us, it was just the next step further. And then we got even better solutions. I think we should talk about two separate things. First is the digital file. So instead of the paper file, you would have the digital file. And that is an electronic system where all the documents are recorded and that I can use from home, from courthouse, from the cafe, from anywhere. And then the other part is the video hearing system. That's a new one. We started using more with the COVID situation, and we have a hearing basically anywhere we are, and the parties are where they are, and we just get together in a video room and have the hearing as we would have in a traditional room.
You got a sense of what it's like for the court system there from Liina. It sounds like it's pretty good pre-pandemic, and then it only got better through the pandemic as well. And so I think this is one of the areas that's like a big sort of highlight for Estonian society in the pandemic, is that the court system was able to move online very quickly, and this was able to reduce a lot of face-to-face interactions. And so I think you get a sense from some of these examples here that this was pretty handy for Estonian people. It allowed very quick adaptation to working and studying and living from home in every walk of life. This digital infrastructure that was in place definitely made lives more comfortable and a little bit easier. And I think, just logically, you would imagine that it would have reduced the caseload as well, because everyone was used to being online, didn't have to go out into the world for any of these services. The infrastructure was there to make that easier. But I should also mention that cultural factors may have had a bit of an impact here as well in some of these areas. So one of the people that I talked to, a guy named Lucas Ilves, he's the government's chief information officer. He told me that there's this joke about Estonian people that when the 1.5 meter rule was relaxed, everyone sighed with relief because that meant that they could move back to 3 meters. So I think there's already this kind of like inbuilt culture of like Estonian people are quite happy to be by themselves. They were already used to working from home, and there was already like high uptake of people being able to work either in the office or elsewhere. And also, they were quite happy to be by themselves. So this is the big kind of core question for me, right? Was e-Narnia a magical bastion in the pandemic? I had read a lot about Estonia during the early stages of the pandemic, with things like, the virus-proof digital state, how innovation is going to help the citizens fight back and improve lives and so on. All of this kind of hype about Estonia's digital services and how they were going to impact case numbers, death counts through the pandemic. And I was keen to have a closer look at some of the data around that, because when you do check it out, this is a graph showing cases per million and deaths per million of Estonia in blue and the two neighbouring Baltic countries of Lithuania and Latvia. And when you look at those graphs, it's actually not too different. Like, certainly in terms of the case numbers, there's sort of like a delayed peak early on, but then things track roughly the same. And if you look at the death count per million there, you might say that Estonia is doing a little bit better than some of these countries, but sort of not markedly better. And when you compare this to Finland, so I wanted to sort of add Finland to the mix here, because Estonia often compares itself to Finland, thinks of itself as a sort of Nordic country as well as a Baltic one. And so you can see Finland there, a neighbouring nation to Estonia. Now, it's a pretty messy graph, but Finland's the dark blue there, and they did much better in terms of cases and in terms of death count. And so for these countries that are all in the same sort of part of the world, and the Baltic states with similar sort of preconditions in terms of healthcare and so on, I'm not convinced that Estonia actually did that much better, and certainly not as well as a neighbouring country like Finland did. So I was curious about why. Like, given you have these systems, it makes logical sense that you would have fewer chances for cases to spread, and presumably a lower death count associated with that. I was curious why. And so I talked to a few different people in the healthcare sector as well, and hopefully the audio will play here now as well. And the first person I talked to was this guy. His name's Preet Tova. Preet, he works in one of the major hospitals in Estonia.
I sent myself home, I think, a week before it became standard practice. And it was, in a way, exciting because, on the one hand, we had no idea it would stretch this far. So we were thinking that all we needed to do was hunker down for a few months, maybe, and everything will pass. And aside from the shortage of toilet paper that everyone was afraid of, there was not a lot of panic about doing this because, every government service is accessible digitally. Everyone in the ministry can work remotely. This was encouraged regardless of a pandemic. And, in terms of whether you needed food or any other kind of service, there was a lot of basically anything could be done with a keyboard and an internet connection. I'm quite allergic to the hype, but I would definitely be unfair if I said that having this fully digital state didn't help during a time when people were no longer allowed to leave their homes, no longer allowed to turn up to work or turn up to government buildings. It definitely helped.
So I went and talked to someone else. This is Dr. Lillian Latz. Now, she runs a team of ambulance drivers at a hospital. And basically they have this system in Estonia, it's called the e-ambulance app, which allows the patient, when they jump onto the ambulance, to basically swipe their electronic ID card, and then all of their medical records, including drugs they take, that comes up on the screen.
Yeah, I think it's most important for the critical ill or the trauma patients. We can see the screen of the defibrillator monitor also in the resus room. And when we know that the trauma patient is coming in, we can see what the heart rate is. We can already prepare ourselves what's coming in. We can maybe order some more blood supplies. We can call the surgeons down. So we can just be more prepared when a critical patient comes in.
But then when I asked her about whether she'd noticed any difference in the pandemic in terms of lives saved and so on, she said, well, we don't really have any strong data on that. Basically, in my line of work, what it helped me most with was with admin. because instead of having to fill out dozens of forms at the hospital, she was able to basically put everything into this digital system very quickly. It was all associated with the person's electronic ID, and so it maybe sped up the amount of time she had to spend on each patient, which is still it's a significant impact. But she wasn't so clear-cut on this technology actually making any difference in terms of saving lives and so on. And so I think the take-home when it comes to looking at digital tools like this in a pandemic is that, yeah, many of the limitations were physical and not digital. And even if you have the best digital tools in the world, you're not necessarily guaranteed to save lives in a pandemic with them. And I also think that I heard some stories of some of the digital services that they tried to build during the pandemic to adapt more quickly. They didn't work terribly well. So one example of this is their vaccine rollout portal. They set it up quite quickly to try and get the vaccines out to people, and it crashed quite quickly as well. They also had these hackathons to try and use government data, caseload data, hospital bed data to try to help the government in some way. And these yielded pretty limited results too. And so I think the kind of take home is that Estonia's digital services were definitely useful, but mostly in these kind of fuzzier areas of making life easier or making the transition to home faster, more possible. I think there's also some evidence from talking to people there that there may have been less economic damage because of this as well. So compared to neighboring nations, Estonia wasn't as locked down as other Baltic countries. So I think, the digital services there were probably useful. But I think the main gain is this last point for me, which is that I reckon it was a good testing ground for what existed in Estonia already, and I think it'll be useful for them going forward, because we are entering into this sort of new digital hybrid life where you've got half the people here in the room and half the people watching on Zoom. And if you set up some of these services and test them in something like a pandemic, then that's going to be quite handy to make sure they're rigorous going forward. So those are the two case studies that I wanted to whip through today. There's a couple of just final points that I'd like to make here at the end, which is, I think, coming out of the pandemic, and we're certainly not out entirely yet, but as we slowly start to emerge, I think there's a few post-pandemic questions that everyone's thinking about, or at least should be thinking about. And one of them is, how should we define success or failure in a pandemic? Another is, how do we disentangle the different factors and analyze their impacts, whether it's, COVID zero approaches or digital tools and their impacts on cases and deaths or whatever. And also, how do we weigh up things like the raw numbers of cases and deaths against other variables, including like longer-term morbidities and so on. And so I think there's lots of ways that you can answer these questions, but what I find most kind of disturbing at this point in the pandemic is that we've kind of just stopped having these conversations and making the effort to compare countries. I think we've reached that point where a lot of people are fatigued with COVID information and they're looking away, and their attention's been drawn to other bigger issues in the world now as well. But I think we kind of need to start this process of asking these big questions and embracing the complexity that we get when we talk to other nations or other parts of the world and hearing about their experiences. And I think it's, I would hope that after so many years of looking inwards, we start to look outwards and learn these lessons so that, whether it's the next pandemic, which we're already being warned of, or whether it's the tail end of this one, we can learn some of these lessons from all of these little social experiments that we've had around the world over the last couple of years. So I believe this process can help us answer that question of where to next. And I think this is a really important question that we should be asking, because we've seen how drastically and rapidly societies have changed. And as we step into, I don't know about this term, the new normal, but as we step closer to this new normal idea, I'd be curious to ask everyone, what should this look like, and what have we learned from other countries about how we want our societies to look going forward? And so I think we should be using these social experiments from around the world to avoid some of the catastrophes that we have seen, whether it's that Christmas spike in Australia, or perhaps even the slow vaccine rollout that we saw in Australia. And hopefully we can learn some positive lessons from countries like Estonia's as well, which might set us up for these future hybrid lives. So that's everything that I wanted to go through with you today. It's a bit of a whirlwind to go through 2 countries so quickly, but I'd be curious if you have any questions or even comments as well to share about other nations that you've lived in or that you currently live in and your experience through the pandemic. Thank you.